Hi, my name is Olivia Meyer, and today we will be discussing leukemia and how do you prescribe exercise for patients who are suffering from this disease. So, to start off with, what is leukemia? It is a cancer of the body's blood-forming tissues, which will include your bone marrow and lymphatic system. It predominantly affects your white blood cells, and the bone marrow actually produces abnormal white blood cells, and this will affect, the person's immune system. It'll make it hard for them to fight off diseases and can cause a lot of overall complications. There are a variety of different types of leukemia. However, there are four main ones that we will be discussing today. The first one is acute lymphocytic leukemia. The second is acute myeloid leukemia. The third is the chronic lymphatic leukemia. And then the last one is chronic myeloid leukemia. And in the next slide, we'll be discussing the classifications and why they have the names that they do. But something to note is that acute leukemia involves very rapidly, while chronic leukemia develops slowly, and sometimes patients can go for years without realizing that they need treatment. So, the classifications. So, the first one talks about the first classification discusses what cells are being affected. So, with lymphatic leukemia, it affects the lymphoid cells, and that make up the immune system. Wherein myelogenous leukemia, it affects the myeloid cells, and myeloid cells will actually turn into red blood cells, white blood cells, and platelet-producing cells. Now, as mentioned earlier with the acute and chronic leukemia, that is referring to the speed of development. So in acute leukemia, it develops very rapidly, and the abnormal cells are actually immature, and they can't perform and they can't carry out any function, which is why it develops so quickly. Whereas in chronic leukemia, either too many cells or too little are being produced, but the cells are mature and may actually be able to carry out function for a bit of time before they are probably not able to work anymore. So as we just briefly went over, acute lymphatic leukemia is most common type of leukemia, and it occurs mostly in young children. Acute myelogenous leukemia occurs in both children and adults, but often is acute in leukemia, which means it develops very rapidly. And then finally, both chronic lymphatic leukemia and chronic myelogenous leukemia mostly occur in adults, and they may go years without realizing that they need treatment or before any symptoms occur. So though there is not one specific thing that will determine whether you develop leukemia or not, there are several risk factors that need to be taken into account. So the first one is if the patient has had previous cancer treatment before. Chemotherapy and radiation therapy can result in an increased risk of developing leukemia due to exposure to these chemicals and other hazardous things. Exposure to certain chemicals, such as benzene, can increase the risk of getting leukemia. Genetic disorders such as Down syndrome are associated with leukemia, and along with that, family history, or if you have any family members that have previously had leukemia or had leukemia, that could be a risk factor as well. And then smoking will increase the risk of myelogenous leukemia specifically. When looking for leukemia, there are several symptoms to consider. These are the most common ones, but they are definitely not the only ones. So fever, chills, persistent fatigue or weakness is a huge one. Frequent infections, and again, that has to do with the white blood cells being abnormal. The body's unable to fight off infections like it's used to. Losing weight without trying, if you have swollen lymph nodes, because again, it's infecting your lymphatic system. Easy bleeding or bruising, recurrent nosebleeds, petechia, which is tiny red spots all over the body, or excessive sweating, could all be symptoms of leukemia. But again, it's not just limited to these ones. So when we are diagnosing leukemia, there are three main methods. The first one is a physical examination by the doctor, and they'll be looking for signs such as pale skin, swollen lymph nodes, and an enlarged spleen or liver. The next one is probably the most common form of diagnosis, and it is a blood test, and they just take a sample of your blood and send it to a lab, and they're just looking for abnormal levels of red or white blood cells or platelets. And then finally is a bone marrow test, and they take a sample of your bone marrow and they send it to a lab, and they look specifically for leukemia cells. This one is best used to determine what treatment option would be ideal for the patient. So when we're looking at treatments for leukemia, there are a variety of different kinds, and depending on the factors and the patient, it will determine what treatment option is best for them. So the first one is chemotherapy, and this one is pretty aggressive and uses chemicals to kill the leukemia cells. And depending on the stage or the treatment that the patient needs, they may receive a single or combination of drugs. Though this is a very effective method, it has a lot of side effects, including nausea, chronic fatigue, which can be very discomforting to the patient. The next one is biological therapy, which uses treatments that work with the immune system to recognize the cells and attack the cancer ones. Targeted therapy, which is drugs that attack specific weaknesses in the cancer cells. Then there's radiation therapy, which uses high energy beams, such as X-rays, to damage and stop cell growth. And then finally is a stem cell transplant, which is a procedure that replaces diseased bone marrow with healthy ones and requires a bone marrow transplant candidate. So when treating leukemia, one of the most effective ways to help it actually is with exercise. Not only is it beneficial to the patient, but actually will decrease their discomfort overall from whatever therapy they are receiving. So with leukemia, the response to exercise includes increased cardiovascular endurance. It will reduce the fatigue, which is huge because chronic fatigue is a very common symptom in leukemia patients. It will reduce depression or other mental ailments. It helps manage treatment-related side effects, and it'll help maintain and increase the quality of life for the patient. However, with any patient, there needs to be exercise testing screening, and if the patient has any of these symptoms, then they should not perform exercise and need to be cleared by another doctor or may not be able to participate at all. So if there's any cardiovascular disease, acute or chronic respiratory diseases, acute or chronic abnormalities in the bone, joint, or muscles, if they suffer from dementia or any altered mental status, if they have active malignancy or other things such as active bleeding, acute thrombosis, ischemia, if they're hemodynamically unstable or they have any uncontrolled pain, they should not be cleared for exercise testing because this could endanger the patient. And though exercise is beneficial, we want to make sure we are doing it in a way that is safe and healthy for the client. So when working with patients with leukemia, there are several special considerations. As mentioned earlier, a really major limiting factor is the chronic fatigue due to the therapy and just the disease itself. And when you're planning your exercise prescription, you need to take into account that they're going to be easily fatigued. Also, they're most likely going to be experiencing musculoskeletal pain and cramps, probably from the fatigue as well as the therapy. They may have malaise or swelling, which can be uncomfortable. And then they also will experience nausea and overall discomfort from the different therapies, particularly chemotherapy causes a lot of nauseousness in patients. So for my case study, I chose to look at a small boy, a 26-month-old boy with acute myeloid leukemia. So it's affecting his myeloid cells and is unfortunately progressing rapidly. When he came in, he was experiencing both parlor and splenic enlargement. So his risk stratifications, he has a normal BMI because he's a child and a young child. He has no exercise history though since he is pretty young, and he is currently experiencing extreme fatigue, fever, and unfortunately diarrhea. So for his risk group, he is considered low risk because he has under 2 symptoms and has no cardiovascular issues. However, there are special considerations that need to be accounted for, such as the chronic fatigue, and again, the fever and diarrhea can play a huge part in the exercise prescription. And then overall for his goals, we're looking at improving his muscular strength and hopefully gaining muscle. We'd like to decrease his fatigue and just improve his quality of life and make daily activities easier for him. He's a child, he should be out having fun and not having fun playing games and not sitting in a hospital bed tired. And some special considerations are the fact that he reports of extreme fatigue and weakness, which will alter how frequently we're doing the exercise, the intensity, and the type. So with the exercise prescription, so the frequency, I would recommend 3 to 4 times a week. This will help the patient reach his goals, but it will not leave him fatigued. I think if you're doing more than 4 times a week, it can get to be a little exhausting for him as a child. In addition, with probably the pairing of, occupational therapy or the chemotherapy, whatever treatments he's receiving, it can be a lot. Intensity-wise, we want to raise the heartbeat. I would say about 40 to 65% of the max heart rate in order to get those health benefits, but I believe over that, the patient will have a hard time getting there due to the extreme fatigue, and it is just best to keep at a range that they can hit and not be discouraged. And then for time-wise, I would want to do between 30 and 45 minutes, but with incorporated rest breaks to deal with the fatigue. There's no way that the client will be able to go the full 30 to 45 minutes, not only because of the fatigue, but because they're a child. They're going to get bored after 45 minutes. Or bored after longer than 45 minutes. So incorporating those rest breaks will be nice for them to relax, and then, starting up a new activity will hopefully pique their interest and keep them going in the session. And then finally, with the type, as mentioned previously, it's important with kids to make the exercise prescription fun so that they don't get bored. So for aerobic or endurance training, we could play games like Mother May I or Duck Duck Goose. Mother May I, is a lot of walking, and Duck Duck Goose is a lot of running. And it's a great way to get the child's heart rate up, to get him moving, but he's not going to be bored just, he's not going to walk on a treadmill. He can't. He's a child. And it's just a great way to get the heart rate up and improve these aspects of his health. And then for resistance training, you could have them squat down and pick up a toy, or, squat down and pick up a ball. Since he is over 2 years, he can listen to instructions. So you could ask him maybe to stand on one leg and toss you the ball, or have him push like a little shopping cart around filled with toys, or, just try and incorporate a bunch of fun ideas. We could play hopscotch or jump rope and do different things that get them actively moving without them realizing, so they don't become bored. So finally, what is the take-home message for this? For their patient, for leukemia patients, they should know that exercise is incredibly beneficial for them and can help improve their muscular strength, endurance, and overall quality of life. And it'll help decrease their muscular cramps and pain and potentially reduce their fatigue. For exercise specialists and therapists, it's really important to keep in mind that when working with these patients, they're going to be fatigued and they're going to be tired, and you need to keep that into account when planning their exercise prescription. And you also want to mix it up, do a combination of light aerobic, endurance, and resistance training to, incorporate all those health aspects. And then a really big one is the environment needs to be sterile. Since this disease attacks the white blood cells, their immune system is incredibly low and low functioning, and they can catch stuff very easily. So you need to make sure the environment you're working in is clean and sterile for the safety of your client. And then finally, modifications are key for this disease, and they're going to be very fatigued and tired. So finding different ways to incorporate these exercises in maybe a lower intensity way will still provide, exercise benefits to the patient without not only fatiguing them and discouraging them, but, they're able to do it and they'll have more fun that way and feel like they're progressing more. So these are my references. I hope you enjoyed this presentation and that you learned a little bit more about leukemia. Have a nice day.